Well, welcome everyone. Glad you all could make it in person, and welcome to the people making it just online and joining us. So, we made a big title for a big presentation, Anthroposophic Medicine, How Do We Humanize Medical Care? And this is going to be really an introduction to the picture of the human being that we use in anthroposophic medicine. Um, and that's actually also used in Waldorf education. It's used in biodynamic agriculture. Um, go that way. There. So we look at it really as a lens of viewing the human being. And there's a few of them. So there's a fourfold one and a threefold one. And then we'll look at how does anthroposophic medicine look specifically at things like diabetes, hypertension, and also ear infection, since we see a lot of ear infection in kiddos. Do you all have children in the school? Nobody?
Not today. If you asked us, a couple of years ago.
This is one of my favorite slides, which is sort of the model. Hello, Matt. Oh, wonderful. And if you look at the pyramid, that is what we look at as evidence-based medicine today. That you have preclinical data where there's maybe laboratory studies and animal studies, and it goes up to case reports and case controls and cohort studies, randomized controlled trials, meta-analysis, and then what we call clinical practice guidelines. So for instance, in cancer, there's like a whole cookbook. If you have this, these are the appropriate things you could do. In pediatrics, it's the same thing, no matter what. So we sort of like those guidelines. But I would venture to say that the recent pandemic proved that this model doesn't quite work. When we'd like to have clinical practice guidelines, that's great, but it of course takes a lot of time to get up that chain to this is right. It takes a lot of time to do randomized controlled trials. And that isn't so flexible, I guess I would say. It's also not all of what I think medicine is. And this isn't my model, but I like the three-legged stool approach, that evidence-based practice is really one leg of the stool is this pyramid of all of this important clinical research. The other leg is clinical experience. And the third leg is really patient preference. It's really driven by what is the patient's worldview. What will they accept as a treatment and what do they not want? You could potentially say that that's the most important thing. But they're certainly all play in. And if we only do the pyramid, you're going to get patients that are dissatisfied and you're going to get doctors that are burned out, which actually is exactly what we have. So what is anthroposophic medicine? It was founded now quite a while ago, about 100 years ago, by Rudolf Steiner in cooperation with the female Dr. Ida Wegman. And no, there weren't that many of them back then, but she was a powerhouse. And we don't really look at illness as just a chance occurrence or a mechanical breakdown, but it's really something that's intimately connected with the biography. And I look at anthroposophic medicine as having sort of an outer path of, yes, here are the treatments that are possible, but also an inner path of that's self-development and meditation. And just to give a little bit of perspective of what we have in Europe, these are all places. Well, I didn't go to the bottom one, but Um, yeah, there are two places at the top that I trained at. Um, they have whole integrative hospitals that are part of the public system in Europe, and it's a pity we don't have that here because it's quite amazing what they are able to do there. So we have some things in the U.S. Um, smaller, but still we have them. There's about 120 docks in the U.S. And we're looking at really about a 100-year uh, history of a system, and it's quite mature actually. There's inpatient care, there's actually professorships in Europe, there's university that has a nursing school, medical school, a residency program in integrative medicine. Wow. And different ways of reaching the human being, um, looking at them as a fourfold and a threefold. Uh, One of my favorite things is the community initiatives. The Camp Hill community, there's addiction treatment communities that have become quite popular over the Germany and the Netherlands. And actually, the um, there's a few places that are treating eating disorders. So in around Stuttgart, that's there's a pediatric psychiatrist that I met. Um, Quite fascinating. So they live and work on a farm type situation, and that in itself is part of the therapy of like um, really being yeah, they're doing something constructive and having a rhythm through the day. Uh, in a way, maybe taking your mind off of food. And there's actually quite a huge amount of success with treating these eating disorders, which is actually it almost matches the mortality of childhood leukemia and lymphoma. I was shocked to hear that, but like you get actually somewhat similar data. So we talk about this salutogenic approach in anthroposophic medicine. Um, and what that means is we're really using potentially both conventional and anthroposophic medical products. Um, so many times we're able to not use the conventional. Sometimes we use them. Um, the remedies that are made by the anthroposophic pharmacies, they include really mineral, botanical, homeopathic remedies. There's anthroposophic nursing, there's rhythmical Einreibung, there's lots of different compresses. We brought one little booklet of all the compresses that we do. There's eurythmy, which is a stage art, but is a is transformed into something that's therapeutic in anthroposophic medicine. And we're very lucky to have a therapeutic eurythmist who's usually here, but she's in Europe presenting to about 1,000 doctors and therapists right now. And then we have art therapy, painting, sculpture. There's really a lot of potential approaches to the human being. And so what is this fourfold lens? It's basically four different aspects of the human being. The physical body, which is the mineral or the earth element. And of course, in medicine, we might do something with this with something surgical. Um, the etheric body, which I would say we have in common with plants, it's more the water element. We work on this through improving health functions, and I would say mistletoe does this, eurythmy therapy does this, acupuncture and homeopathy work on this level. And then you have the soul body or astral body, which relates to the animal and the air element, and that's more the emotional health of patients through art therapy, psychotherapy, relaxation techniques. And then the I organization, which is more the uniquely human. And we're addressing that through biography work, meditation, self actualization, and other therapies that bring warmth. Sometimes we're working on multiple levels at the same time. So, like a ginger compress is going to bring warmth, but also going to really affect, we're putting it over the kidneys, which is going to affect more of the soul body. And this is just a pretty picture um, of the different fourfold that we look at. And it's important to see that there's sort of a crossover or these border phenomenon. Um, we can look at, well, what's really right in between a mineral and a plant. And in between a mineral and plant, you have crystals. Um, some people even are going to say crystals are alive because they grow, they do X, Y, and Z. They're not really alive in the sense the plant is because they don't metamorph. Uh, they can get bigger, um, but they don't do anything new as they grow, which a plant does do. Um, but there are certain border phenomena. I'd say between the plant and the animal, you have things like poisonous plants. Um, and a poisonous plant, you're bringing the astrality into the plant. Of course, you don't want all that astrality in your tummy, like because that'd be bad for you. But you can make remedies out of it. So belladonna is a very potent remedy. Helleborus is also very, very strong. Has some very toxic elements. Deer won't touch it, but we use it quite a bit um, as a homeopathic. So yeah, this is yet another way. The physical is the structural, the functional or recuperative is the etheric, the emotional sensory is the astral, spiritual creative is the I. So you have these four layers that that really interpenetrate in the human being. And then to make it more interesting, we also have a threefold lens. Um, and this is actually from a German anatomist who is very interested, has been very into anthroposophic ideas, but he's a leading authority in anatomy. What's his name? Röntgen, I think, or uh, but he makes some really cool. He has a whole book that's more for laymen, but he's written a lot during his professor years. So the nerve sense system, the center of that for us is our skull, so which is really a point, a round element. Um, you don't see radiating forces in the skull, not so much. Mostly rounded, and you're receiving the world in the nerve sense system. The brain, of course, we know it needs to be cool. Um, I think in biology class, our teacher asked us a trick question of how much the brain weighed. Um, and the answer is not like the 2.5 pounds that you would think. It's more like 100 grams because the brain is floating, actually. So it doesn't weigh a lot. It needs to be weightless. So it's quiet, cool. This cooling thing, there's um, in people who have out of hospital cardiac arrest and have neurologic issues after that, we will now cool them. And that helps preserve their neurologic function. So some people in these trials, and it's now clinical practice, they're down for quite a long time, often with no heartbeat or getting just CPR. And if you cool them over, there's a protocol where you manage the amount of warmth, especially that is in the brain. And if you keep that cool you can often have a restoration of previous neurologic function, which is practically unheard of before. Um, in contrast, you have the metabolic limb system, and I think it's much more clear in the bony skeleton because you see these radiating forces where it starts with one bone in the humerus, and you have the two bones in the radius and ulna, and then in the wrist you have three, and then four, and then five. It's quite interesting how our body's built. So it's not just radiating, but it's also separating in a way, and long. Uh, and metabolic limb has much more warmth forces and forces that are really transforming world substance. So the nerve sense, you're taking it in, and the metabolic, you're taking it in too, into the stomach and into the intestines and liver, etc. But you're really doing something with it. And then the rhythmic system is in between. So instead of just these radiating forces in the sternum and in the ribs, you have rounded off something in between the skull um, and the long bones. And you sort of actually see a little bit more rounded here and a little bit less down lower. And the rhythmic system is more mediating and balancing. So how does this relate to practical things in medicine? Uh, one of my colleagues is a really good cardiologist in Germany, and he wrote this book, which is translated, I don't know how many languages, but thankfully it's also in English. It's a bestseller in German. Lowering high blood pressure, a three-type holistic approach. And it's written for patients, and there's sort of a questionnaire of which type are you? Um, he did about, a 4 or 5 hour, it was fortunately divided into 2 evenings, not just one. It would have been a lot, but it was mind-blowing to hear him talk about hypertension as a doctor that had seen hypertension before. Um, in many different manifestations. So you have this nerve sense hypertension where you're really having strong astral forces that are overwhelming the body. So it's a sort of this stress type. And that will raise blood pressure. And that category of hypertension, those people absolutely feel horrible when they have high blood pressure. They know it. And I have patients, and I've seen patients like this. Just they feel off. And then you have the metabolic limb hypertension, where these people are usually more metabolic and usually heavy set. And I'll tell you the common scenario. They come in to the ER because their foot hurts. It's a new thing of gout, new diagnosis of gout usually, something like that. And then the nurse gets their blood pressure and it's 220 over 100 and whatever, 110. And you're like, whoa. Now they don't feel bad. They didn't come in because of their high blood pressure. They came in because their foot hurt. And that's so typical. So typical. And in a sense, they have a very, very dense body, and their forces have to work so strong in order to incarnate. Um, and the weird thing there is if you have to be careful lowering that high blood pressure, if you do it fast, they will not like their doctor anymore. They feel bad. They don't like it. They have no energy. So, and that is it is completely a truism in medicine that I had never really separated the categories to think about it. But Dr. Breitkreutz did. And then you have this chaos type where there's complete lack of rhythm and in the life, and you have this like no set schedule. Like you don't know what will happen from one day to the next, and those are the people that tend to have problems with their aorta and other blood vessels. So obviously we want to treat high blood pressure differently, depending on if someone has nerve sense, or if they have the metabolic, or if they have rhythmic system issues. So from a beta blockers, that's not an anthroposophic remedy, of course. That's things like metoprolol or corvedolol or maybe propranolol. And to give a sort of a sense of what these drugs do, they propranolol is used probably more off-label than on-label. It's used for performance anxiety. It's used for panic attacks and things like that. Um, so it's working really on the stress pole. So beta blockers tend to work better in people with this nerve sense hypertension. And then we have other more anthroposophic remedies that are um, more for bringing down the stress in a sense. So there's a gold lavender rose heart cloth. Bryophyllum is very good because it's very relaxing actually. Neurodoron is also nice because it's sort of a universal anti-stress remedy. And then you have the metabolic limb type hypertension and ACE inhibitors or ARBs, which are the medication that may be the best suited for these type hypertensives. And then you're looking at other ways to either help the astral body get into the body, and that would be something like ferrum siderum. So that's meteoric iron preparation, or just the opposite. It's actually opening the body up a little bit. So something with copper. So it's a little more relaxing. Um, but it de-densifies the body. And of course, these are the people that if they lose 5 pounds, they may not need a medication anymore, or that's something that can help quite a bit. Cardiodoron I use in all of them, but it's especially good for the rhythmic system type. And gold is important, and really just restoring rhythm. And Cardiodoron is a very interesting medicine because it's a remedy made of 3 different flowers, and these flowers have aspects that are almost polar of each other. We could go a long time. I mean, you could do a whole hour lecture just on what are the 3 flowers in Cardiodoron. So you have the really tall Scottish thistle, lots of form, um, and then you have a very very short plant called the cowslip, um, and it's really just tiny. And then you have this weird plant called the hyoscyamus, or black henbane, and it grows pretty much horizontally. Uh, so the one's really short. The other one is like, no, I'm not going up vertically. I'm going horizontally. Uh, it's interesting. Um, but there are many studies on Cardiodoron. One of my colleagues did a study in the VA looking at heart rate variability. Um, I've used Cardiodoron with a patient that came into our office in new onset atrial fibrillation without chest pain. Chest pain, they sort of automatically have to go to the ER. Um, but this patient didn't want to go to the ER and didn't have chest pain and was stable. And so we put him on the monitor, and we gave them Cardiodoron and gave them one of the heart cloths, and they actually converted back to sinus rhythm right in our office. It's actually quite interesting. Eurythmy therapy. So of course in the Waldorf School we're doing eurythmy. Eurythmy therapy is different. You have to do 3 extra years of training to use eurythmy as a therapy. So that's basically a total of 7 years. It's a long time. We're very lucky to have Corinne, who has done that training. Um, some of the some of uh, the eurythmy that's done pedagogically, you're doing the and you're doing things all together, which makes sense. You're working in a class. Therapeutically, you may be doing things that look a little bit crazy, or um, or have a much different intent behind them. Um, so I think in a month or two, Corinne is going to do a presentation on eurythmy, but we can go into that more deeply. But in this pilot study, there was a significant drop in hypertension. Um, so there were some specific gestures that were worked with. If you know eurythmy, you know that each of the each of the sounds has a gesture that goes with it. And it's, in a sense, it's what our etheric body is doing anyway when we hear that sound. So we're just making the movement of it. Rhythmic massage, that's something that is useful in um, many different illnesses, but hypertension for sure. And I could see where you'd probably would use rhythmical massage differently in a metabolic type of hypertension versus the nerve sense. So this is just a summary of the stress hypertension versus the abdominal or the chaos. Um, as a doctor, I found this really just inspiring. I just felt dumb that I had never thought of it before. um, and it's cool when you see something like, oh, this really makes sense. Otitis media, that's just our medical name for a middle ear infection, which is to differentiate it from a outer ear infection, which is swimmer's ear, basically. Um, so otitis media is very common among children and still among some adults. Most most children get it because of there's the eustachian tube, as you all know, that drains the ear, goes down into the throat. Now, children, um, as they're growing, before they actually grow, instead of in an adult, we have really a not quite vertical, but much more vertical drop in the eustachian tube, so it drains easier. A child, it's like horizontal. So it doesn't, they get eustachian tube dysfunction more, it backs up and it can get infected. Um, the more metabolic type uh, kids tend to get a little bit more otitis media, I've found. And we'll go into one plant that we use a lot, the lovage plant. And it's very interesting because it lives very strongly in water. It loves growing where it's really marshy or wet. But you see something really airy in it. Um, it has a hollow stem, and the smell of it's really delightful. Here's some pictures of it. So it's hollow, so it's growing, sort of mastering water. It's going from very, very wet. It's got a juicy stem, but the flowers are really, really fine and airy. And these are just pictures of the eardrum. Um, the happy eardrum over here, inflamed eardrum over there. And it's really things going on the inside, and there's a lot of pressure building up. And the pressure is really fluid. And it, of course, hurts a lot. So we're taking a plant that has a gesture of being able to start with water and move it towards air and saying, this will help the ear when it is full of water. And it does. And we have actually some really good studies on this, which is nice. Um, Anthroposophic versus conventional therapy of acute respiratory and ear infections. This is a prospective outcome study. So antibiotics were prescribed to 5.5% of anthroposophic medically treated patients and about a third of conventionally treated patients. Wow, that's a big difference. Improvement within a day happened in about a third versus 16% of the other. So they had faster improvement in the anthroposophic treatment. Now that's only fair because we have so many, if you open that compressed book, there's a lot of things we can use. Satisfaction was higher as well. I don't know if this went into that, but this is also an important caveat here. And I don't know if you all know this, but childhood use of Tylenol and Motrin is associated with both eczema and certainly asthma. There's links. That the more we put those two together, children and adults, and it's interesting. I look at fever, febrile illness, as a remodeling attempt to the human body. And if we're saying no, you don't get to do that, just don't have the fever now, then we're sort of making the human body more dense, and not allowing it to be transformed. The fever itself is actually a beneficial thing. Here's one of our favorite treatments. We have 6 daughters. I don't believe we've ever used any antibiotics for ear infections. We've had ear infections. We certainly have. But this was one of our go-tos, is an onion compress over the head, over the ear. And it works. You can put it in a hat, and you have to warm it up, chop it up, warm it, put it in a little cheesecloth, put it right on the ear. Within minutes, it really takes away the pain, solves the problem. I still use it in adults with eustachian tube dysfunction. Sort of hard on an airplane if you get that, because your neighbor might not like you. This is actually a really interesting study. It was looking at what is happening with the compounds after you cut an onion. And there's like all sorts of compounds coming out of that onion that are sulfur compounds, of course, which is really a loosening type of gesture. The sulfur is able to really loosen things. I found this fascinating. And there's formative forces in the onion and also structural forces. So now what about diabetes? So we have diabetes as well to look at. And of course, you already have a little more clear polarity between type 1 and type 2. Type 1, most of them get that during childhood. There's actually some link between like a serious traumatic event and later development of type 1 diabetes. That it was found in a Swedish cohort study. And with type 1 diabetes, there's an insufficient incarnation of the soul spiritual, and the action of the nerve sense system is really dominant. So they're much more nerve sense people. In type 2 diabetics, you have much less will that's happening in the metabolic system. Now, these people can still have a lot of will forces. But there's a bit earlier separation and excarnation of the astral and eye. So the astral eye aren't able to really access into into the will forces. And of course, it's important to look at what is glucose, because glucose has everything to do with diabetes. And you have this quote from Steiner, which I found really interesting: wherever sugar is present, the eye organization is present. Wherever sugar arises, the eye organization appears in order to give a human orientation to subhuman corporeality. Which is like, oh, whoa, how do you understand that? of course, sugar looks like salt. It's a crystalline form. Um, and it's because that crystalline form relates to consciousness. So we know very well that if we have too little glucose, we lose consciousness. Um, and it also relates very strongly to movement. So these forces of movement come out of glucose. Um, and the idea in diabetes in both types is, can this movement be intentional movement through the eye? That intent behind the movement is important. So yeah, type 1 diabetes, before we had insulin, you could really say this was really a tragic thing because it was a completely catabolic type disease process. Um, the people that discovered insulin won the Nobel Prize really quickly because just the dramatic improvement in saving the lives of all these kids. And by catabolic, I'm talking like these these children really couldn't put on weight; they were just dwindling away. Um, and yeah, the idea in type 1 diabetes is the higher members can't grasp the metabolic limb system. And there's often an overtaxing of the memory and the intellect or a traumatic event. In type 2, instead of catabolism, we have anabolism. So lots and lots of upbuilding forces. As we all know, like we see this a little more often, but we're seeing people that have, a little bit more adipose tissue, which then means that you have insulin resistance, which then means uh, that you can be more predisposed to diabetes. And you don't really see type 1 diabetes. That's never going to come because of pregnancy. Certainly type 1 diabetics can become pregnant, but you do get something called gestational diabetes, which is an interesting phenomenon, right? It's pretty much like an early type 2 diabetes. And it's because that in pregnancy, your higher members have to withdraw a little bit because you want a different person, higher members, you want some room for that. Usually the inner life of the somebody with metabolic syndrome, type 2 diabetes, is very excitable and somewhat impulsive. We're really talking about this in intentional will activities being something very important. We can see more often type 2 diabetes in disadvantaged populations, and that's been very, very long proven, unfortunately. And you can see that this long periods of stress that cause a disconnection of the eye and astral with the metabolic limb system is behind that. It's connected. I used to work in residency. My continuity clinic was Indian Health Service, and over 50% of my patients had diabetes. Um, I mean, it was astounding. But the most astounding thing to me was meeting one that there was one of the billers in the office. She grew up on a reservation, and she said everybody else got diabetes, but her family. And and she told me what they did. They didn't take any of the government food, and that was one thing. And they gardened, and they kept to their traditions, and that gave them resiliency. But to me, that was a big eye opener. Um, yeah, just a beautiful person and very insightful. So, what are the treatments? Rosemary. Rosemary is a plant that has these really strong warming metabolic forces that are in a form. They're in a needle form, which is fascinating. Mistletoe is actually gives a warmth quality in the sclerotic organism. We also use quartz and phosphorus. Um, we use diet a lot, of course, and these oat fasts that I've been sort of hooked into. Those are useful. Now, many people are sensitive to gluten, so we have to get specifically oats that don't have any wheat in the field when they're harvested, so there's no contamination. But if you do a 3-day oats of just eating oats, there's actually a new study, I should have included it, where your microbiome changes if you eat oats, which makes sense. I wouldn't think that any other thing would be possible that would allow an A1C to drop, cholesterol to normalize, weight to get better, hypertension, and all of those things, they improve with these oat fasts. Um, we've had a lot of success with them in people who will do them. Maybe we'll make a retreat center where we open for 3 days and we just have yummy oats. So it it's fascinating. I have a diabetic and his wife. They live down in Florida, and it, they do the oat fast. They started doing it. And the first time they did it, she didn't want to lose that much weight. She's not diabetic, but she wanted to, lose like 6 pounds. And she lost 2 pounds without even trying. But he had an A1C of 8.6, I believe. And it went down to by 2 points, which it takes drugs to get you down 2 points. Like drugs. So I was very impressed. The first person who actually did the oat fast of my patients, I didn't think he would, because diabetics, you have to, I've learned working with diabetics that you just know, like, they're going to do their thing. And you hope that they'll listen to you. But I was like, wow, he did it. And he came back and he was trimmer and was like, what? You did it? He's like, yeah, you told me to. Uh, so eurythmy therapy, they tend to put the D, T, and F, um, the gestures of really incarnating. For type 2, there's more formative gestures that also combat, RSL is going to combat stiffness and help with breathing and transformation. So there's really specific things to do in either case. With art therapy, sculpting clay is very important because you have a will element that you have to be intentional about sculpting clay, or you won't do it right. You have to be very intentional. And there's this concave convex. It has something to do with introversion and extroversion in the soul life. So that's worked with quite a bit. And then there's just a bit about our model, which makes this has worked for us, and just gives us freedom to practice, which I found is very useful. And then we also have the free clinic, which is part of the Georgia Volunteer Healthcare Program. That's about 10% of our patients. So yeah, that's basically people that come to us are like that. And then the cool thing about anthroposophic medicine is there's trainings that happen in multiple countries, including this one. And these are just a couple trainings that have happened here. And here's some references. So any questions? I'm all ears. Yes.
For someone that's having lots of mistletoe therapy for cancer, can that be beneficial for keeping
It's a good question. Yes, I think that there is some data on mistletoe and diabetes. Interestingly, the mistletoes that they're looking at are different species than Viscum album. They're looking at, I believe they're a Korean mistletoe, which I don't know. The Koreans are um, they there was this huge group of Korean doctors that was touring the Filter Clinic in Stuttgart when I was there. Um, I never got to talk to them, but I was very fascinated that wow, here are these here's this whole 30 people that are marching through the hospital. But they're the ones that have taken up doing intrapleural mistletoe for malignant pleural effusions and things like that. I think that the mistletoe generally is working also on against some sclerotic forces. So bringing the warmth forces in and helping to transform sclerosis is important in diabetes, but also in many other conditions.
Good questions. Back to this slide where you mentioned when you showed the skull.
Yes,
You
that's
mentioned
way back here.
that was it. Quiet, cool. So when I went through chemo, I had to keep ice in my mouth the whole time they were administering chemo.
Oh, interesting.
I think maybe it was at least 2 hours. They just kept filling the cup with ice.
Wow.
So I had to keep my mouth cold. um, but I lost my hair, every strand. Um, I was told that there was a patient in Washington State who went through chemo, and she wore a cold cap,
Hmm.
and she wore gloves,
Hmm.
and she wore something on her feet, cold. Never got any side effect from chemo.
Wow.
And I'm thinking, why is it that Emory did not know this? They knew about the ice in the mouth, okay?
And that was like the nurses knew about that and got you the ice and said, "Here, use this."
Well, no, the doctor told me, the
Oh, the doctor
oncologist
did.
told me that they were going to do that. He said it was very important to keep my mouth cold
Hmm.
while it was being administered.
Wow.
But had I known about the cold cap, I mean, I think
Yeah, I
you
know.
yourself, but still, she lost no hair, not
Yeah.
one strand. She didn't get neuropathy.
And we even have like donated to us the free, what are they, the cooling of the hand and feet. Really, those are for the nails and neuropathy
Yeah, I have
prevention.
neuropathy right now. But I'm just so surprised that Emory didn't know anything about that. I mean, why is that?
That's why we need to support people like him.
Right. And my second thing was I get the pain from the eustachian tubes when I fly. Um, and I don't know, they're you can take what the Sudafeds and the nasal sprays and chew gum. But I wonder if you do a treatment like an onion treatment before you fly,
Yes,
how would that affect that?
I've had people do that. Yeah,
Really?
it does help.
Oh,
Um,
Maybe even before
but
the hyperbaric too, because they recommend
yes,
a hyperbaric chamber.
that's actually a good point.
wow.
Did you hear that, Marie? Maybe try that.
Hmm.
Because they were recommending you do the hyperbaric oxygen chamber, but you have the same experience at altitude.
Right.
So if you could try
Yep.
onion, you would know. For
Yeah,
both.
that's true. Yeah.
You mean eat it or?
Really? Yeah, it is. It is. That's the ingredient in the onion. Right. Oh, that's what you're saying. I don't know. As a supplement. Yeah, but when you're flying. Oh.
Or Uriel makes a little ear oil that has levisticum and some of the alliums in it. It's a little easier to apply than a whole onion right there, but it's not everything is perfect, but it certainly can help. Like I've had the ear compress, the onion compress work quite a bit. Some, yeah, I think that warmth is really useful. Some cancers and chemotherapies you can't and shouldn't use a cold cap for. Um, like lymphoma and leukemia, you really shouldn't because it you don't want what you're doing with the cold is much more physical. Although I don't know about the eating the ice. That's
Yeah,
actually
they said
interesting.
something about my throat and thyroid protecting it,
Uh
but this
huh.
whole protecting it. And I
Because
don't
it
have any issues, as far as I know. A lot of people, have issues. The chemo can do a whole lot of damage. Um, but I had multiple myeloma. That's the type of cancer. I don't know whether that was because they didn't mention the cold cap.
it
Or,
might be because for breast cancer, for instance, the cold cap is fine, but for myeloma, if it could hang out in the bone in the skull, you wouldn't want to have a cold cap.
oh, that's probably why then.
I don't know about the hands and feet though. That's a good question. I don't know about that. I mean, I don't know everything, but I do know that sometimes you really shouldn't use it.
Wanted to ask about the art therapy. I have a college student right now that's looking to go into art therapy, and she's
Oh,
having
neat.
a difficult time finding any schools for of that. What type of art therapy or what type of education would you have art therapy at your clinic? Um, what type of educational path would you move in towards?
I would do what. So Jessie is our. She's currently calls herself the art facilitator, um, but she's in actually a conventional training as well as an anthroposophic training simultaneously. And they both the anthroposophic training is in California. I think she is going somewhere in Indiana, but I could get more information from her. I think she's presenting in a couple months, right, or next month. I don't remember, but yeah, she would have far more. But that's actually a great question. I know there's resources in the U.S. for that. Well, so hopefully this gives sort of a picture of, um, yeah, like just because you have hypertension, maybe that's too simplistic. Like there might be three ways you could have hypertension, or diabetes is far more clear cut, but we don't. I mean, you do have the name, like there's sort of white and red hypertension, like the blood and the nerve. Um, so you do have some of that in medicine, but it's interesting that we don't emphasize it more. Um, no, not necessarily mainly stress, but I do think that having a long history of um, of being disadvantaged, um, for sure, will give a predisposition of type two diabetes. Um, there is more of an active, not necessarily, yet usually more impulsive soul life in type 2 diabetics.
And just curious, what's the shortest time observed measurable effects in a patient with an oat fast over how many months?
What do you mean?
1 month, 2 months, 3 months? How long before you saw a difference in the shortest time you saw a difference in a patient? I know this is something you recommend over the course of multiple months.
Yeah, no, I saw a difference in 6 weeks. A big difference in 6 weeks. Yeah, just 3 days.
Once a month.
No, you just the easiest is just pick the first 3 days of the month and you eat oats those 3 days, and it's simple,
Just oats.
just oats. I mean, some people will spice it up with a little cinnamon or put in make cold oatmeal and put in cucumber or something, um, make it a little interesting, but generally, yeah, it's a very simple thing. It's age old. I mean, this is how it was one technique that they used in type 2 diabetics before we had any medications.
And so you eat the oats, that's all you eat for 3 days.
Yes. Yeah, it's a boring 3 days. It's supposed to be like basically the equivalent of 3 meals of oats. Um, yeah, I think a couple cups or yeah, I just saw like 2 weeks ago there was a study that talked about the microbiome shifting with oats. So I need to harvest that and put it into my presentation because it was like, of course, that's how it works. Good question. I don't know. I think that oat milk wouldn't by itself work because you don't have the soluble fiber. It's probably okay.
As long as there are no sugars involved in any type.
Right, that's true.
How long do you think you would have? How often would you do the fast? Because you just continuously.
No, you wouldn't
So,
continue.
so
I just tell people once a month.
3 days a month for as long as
You don't have to stop. It's not necessarily a bad thing for you. Yeah, I have people that have done it for 6 to 8 months in a row.
find information about this online or is
I
this
have a little handout. I mean, I learned about it from Matthias Gierke because he's one of he wrote a book like this thick. It's actually now twice that thick. It just hasn't been translated into English, the one that's like twice that. But it's all, I mean, I don't know where he got the time to do it. It's basically a big, big textbook on anthroposophic medicine. And in the diabetes part, he has the oat fast. And I was like, oh, that makes sense. I'll try that. And I used it, and then my patients did it. And then they had results from it. And I was very happy to see that.
Although you didn't mention this, Mark, but I have a question about, um, I've read a book recently about the liver cleanse, and they
Ah,
recommended the celery juice. I don't, but I just read it. I haven't done it yet. What is it? Is that something that you could follow, that we could follow if we wanted to?
yes, I just finished a handout on an anthroposophic liver cleanse, which uses several remedies that's really helping help the liver in its supportive and life processes. Um, has dandelion and tin and uh, what else is in the liver cleanse? Oxalis. Oxalis is wood sorrel, and it helps the processes in the inner body and the inner organs. It stimulates those.
So would that be as effective as coffee
Um, I think coffee enemas are very used for very different reasons. I mean, coffee enemas are very cleansing. I mean, I don't tell everyone they have to do coffee enemas by any means, but coffee enemas are supportive to the liver. There's evidence that they help glutathione, which is that's actually one reason that we think Tylenol and Motrin can prompt asthma because they will reduce the glutathione in the lungs, which then allows for this inflammatory disorder. But anyway, yeah, glutathione is prompted with these types of enemas. But
Is there any additional foods that store biome?
that's a good question. So yes,
Take antibiotics or something.
um, I think you need more than just food to do it, but I think some probiotics are very good. Uh, my favorite is Saccharomyces boulardii. Uh, just a that comes from. It may actually be one of the oldest probiotics. Captain Cook, I think, uh, documented way back hundreds of years ago. The Fiji Islanders would eat lychee fruits that were like had this yeast on them when they had dysentery, and it would cure their dysentery. Well, that yeast happens to be Saccharomyces boulardii, um, and number one, it's a yeast, so that's great if you're on an antibiotic because the yeast is typically not killed by an antibiotic.
Can you spell that, please?
Yeah. Yes, Saccharomyces is Saccharomyces, and Boulardii is Boulardii.
SACH. That's what I got.
Yeah, SACH. Gut Restore by True Botanica, that is Saccharomyces boulardii. Or Floristore, which you can get almost anywhere. That's a good probiotic. But for instance, the red mucilaginous type red peppers, pomegranate, cranberry, all the red mucilaginous type vegetables, fruits, those are really good for your gut microbiome. Um, One reason they're good is that they are what Akkermansia eat. And Akkermansia is a superbug that we didn't know about 10 years ago, even, or 12 years ago. It's amazing. Like, if you want to get your name made, just study the microorganisms in the gut microbiome because we don't know really anything there, hardly. So those would also be ones to think about.
Did you say the brand is Gut Restore?
That's a brand from True Botanica, and I use that one a lot. If Saccharomyces boulardii has probably the most randomized controlled trial meta-analyses driven data for prevention of C. difficile, uh, actually increased elimination of H. pylori if you're on an H. pylori protocol. Uh, there's several other things, but like antibiotic associated diarrhea, that's one. Um, but it has, the list just keeps going. It has a lot of studies on it, far more than our yogurt uh, organisms, which are good. They're good organisms. Anthroposophic medicine.
Anthroposophic medicine. Say anything about the gallbladder, salts, grapefruit, olive oil.
I don't know if it would say anything specifically about them. I mean, in general, it looks at the liver and gallbladder as, um, I mean, the gallbladder in it is really its own organ, uh, encompassing planetary forces. Like each of the organs have to do with that goes a little further afield because there's a sevenfold that we look at in the organs, and the liver has to do with the 10 forces of Jupiter, and the gallbladder has to do with these will forces in Mars. So it's quite interesting, um, and you can tell, um, yeah, when the Mars forces aren't really working well, if the gallbladder has congestion, etc., you can absolutely see that biographically many times. Like, you're looking at somebody who's stuck. You really are, like, if you're looking at somebody who's got a malfunctioning gallbladder that is just sort of lazy, in a way, because some gallbladders are, like, we do stress tests of on the gallbladder of how much bile do they secrete when you stimulate them. um, and I mean, we do that pretty routinely. They're called a HIDA scan. So you can tell, do you have a normal functioning one or not. I would say the ones that are not normally functioning, there's something biographically going on there too, where I think that usually, I don't want to overgeneralize, but usually the person is really stuck.
in their life.
Yeah.
I did one the first time that it was like the crystals came out. It was amazing. It was like they say that's like the cholesterol or whatever. And then the next one was like these little green peas.
Hmm.
And then the next gelatinous kind of peas, like almost 40 of them. And
Wow.
the third time I did it, graduated to the dark green. It looked like little bitty dark green stones, like malachite or something. And that was supposed to be really older. I haven't done one in a while, but it was just amazing how much came out. I mean, in fact, the first time I did it,
Wow.
supposed to be with anger, dealing with anger.
Hmm.
I did it, and I sat outside, and I was like, I mean, someone could have said, we're starting World War III in 3 minutes. I mean, it was like I was on the run. I mean, because I had so much anger in my life, and this literally cleansed the physical, well, part of the remedy.
That's interesting. Yeah, and there's a gallbladder remedy that we we use called coleodoron, which is a gallbladder. Um, it's made from a plant mostly, and it's a bitter that you take. But it often, when people take that, they have emotional things happening too. Yeah.
Because our body stores all that.
It's fascinating.
So what say you about fermented foods?
I think generally they're very good. You just there are a few there is a subsegment of people that don't tolerate fermented foods well. I don't know if you've heard of the people that have trouble with histamines. Um, and if you look at what foods are really high in histamines, unfortunately, some of my favorite foods, which are all the fermented foods, are very high in histamines. So um, there's an enzyme that some people are deficient in called diamine oxidase. And it's an enzyme we produce. Like, we make it so that when we eat things, we destroy the histamine so that it doesn't, we don't get sick. Um, and to me, it was very, I do a lot of gut work with people, but sometimes I've found that just empirically adding in diamine oxidase, um, just to see, because if and I've had people say, wow, whenever I ate before, I feel like I ate an elephant, and I mean, I just feel like a brick is in my belly, and I feel awful. Doesn't matter what I eat, practically. But then when they added the diamine oxidase supplement with the meal, they said, wow, I can go out to eat with my husband even, and I can eat whatever. And I found that was interesting. So to me, that was a big red flag. I said, wow, you need to really go on a low histamine diet, because it's clear that's something that's a big problem. But in general, I think fermented foods are very, very, or one of the best things you can eat. There's always caveats, isn't there? It's like, oh, except for if you have this, then you can't have anything fermented. I mean, I don't know if kefir or all of that it would have histamine in it or not. I know kimchi and sauerkraut are high histamine foods. I know, I love sauerkraut.
Is there a big difference as far as the nutritional value between sauerkraut and the kimchi, other than like the cayenne pepper? Would you say that the kimchi is more powerful?
I don't know, actually. I'm not sure. I think of them as pretty equivocal. Um, but that's just an offhand remark. I can't say I'm an expert there. Good. Well, this was a fun little get together. Thank you all for coming.
Thank you.